If your acromioclavicular joint pain is not settling down, it is really important for a period of time, maybe 4 to 6 weeks, to try and modify the activities, and particularly those ones that are causing you discomfort. Now remember, you may not actually feel discomfort during the activity, but it may be worse afterwards, and those are the activities you may want to consider modifying. The general advice that we give, but obviously it does vary from patient to patient, is to try and avoid sleeping on the side of your acromioclavicular joint pain. We would also suggest in the gym that you want to avoid things such as a cable fly, because that activity comes across the midline and that can often cause acromioclavicular joint pain. So do avoid any activities that come across the midline. The second set of exercises that you need to be cautious with an acromioclavicular joint sprain is upper body plyometric exercise. For example, burpees do put a lot of pressure onto the joint. I'm always looking for an excuse to avoid burpees. There is one. The third set of exercises that you need to be cautious with is anything where you're pushing above the body with quite a bit of weight. Now just remember, if you get no pain with it during and you get no pain afterwards, then it may well be okay, but most acromioclavicular joint sprains that we see do need to avoid that heavy overhead press for a period of time. It is important with a acromioclavicular joint pain that you are doing some exercises, and actually we've found over the years, unless you've just had an acute injury, then actually exercise and moving is actually very useful for the healing of the joint. The sorts of exercises that we would recommend in the gym would mainly be row type exercises, such as a bent over row or a low row. However, we would suggest that this is done under the supervision of a physiotherapist, because every acromioclavicular joint problem is slightly different. Obviously, if you've got any questions about your specific condition, we're more than happy to answer it, and we would advise that if you really are struggling with this, then it's worth booking in to see one of our expert physios.